Good afternoon. I am Ellen Jones, the Public Information Officer for the Arundel County Department of Health. Welcome to this week's Health Department's COVID-19 Facebook Live broadcast. Today, we will have our health officer, Dr. Nilesh Kalyanaraman, to provide local information and updates, and our Children, Adolescents, and Family Services Manager, Catherine Madison, to address coping with COVID-19 and other issues. They both will provide answers to questions that you submitted on our Facebook AA Health comments or by email at covid19info@aacounty.org. So now, Doctor, let's give us a few updates. Thank you.
Thank you, Ellen. It's good to be with all of you today. Thank you for joining us on a Friday. We wanted to give you a few updates about where we are. We have over 1,200 cases here in Arundel County. The mainstays, the things that we continue to talk about, are making sure that you continue keeping 6 feet from others, limiting your only those things that are necessary, just going to the grocery store, teleworking or distance learning if you can, and then making sure that you're performing the proper infection control, so washing your hands frequently, using hand sanitizer when soap and water isn't available, making sure that you're disinfecting frequently touched surfaces. Those are going to continue to be the things that we need to do in addition to face masks. And you saw that I took mine off just to be able to talk to you. The face masks are going to be a key to all of what we're doing in the not just in the coming days and weeks, but the months as well. We've found that they are effective in decreasing a person's ability to transmit COVID. And the big reason that we care about that is that we now know, and we've learned, that people without symptoms who have COVID can pass it on. And that's why the masks are such an important part of what we're doing nowadays. Always want to talk about how we are moving forward, and that's testing, contact tracing, and infection and quarantine. So those are the pieces that when we talk about, okay, what comes next, that's the part that's going to come next, the testing, and we've been ramping that up. There are more and more providers throughout the county who are providing testing and access to testing. I want to particularly thank Bay Community Health down in the South County, who are now doing testing 5 days a week. Our colleagues at BWMC and Anne Arundel Medical Center, who are doing testing as well, urgent cares, primary care. The more of that testing that becomes available, the better we are able to give people information about what their COVID status is. The health department is also making sure that we're doing testing 5 days a week. So we have our partnership with the Maryland Department of Health, Wednesdays and Fridays at the Glen Burnie Veep site. We are running a drive-through testing site at our building on Harry Truman on Tuesdays and Thursdays, and we're doing pop-up testing, walk-up testing. This week we did it in Annapolis at the Parole Health Center and tested over 130 people, and we're going to continue to do that on Mondays throughout the county. And the real goal there is to make sure that everybody has access to testing, even if they don't have a primary care doctor. Contact tracing is the piece that follows up on that. And about 3 or 4 weeks ago, all of a sudden, the world is really familiar with the phrase contact tracing. But it's something that health departments, including ours, have been doing for decades. And it's the way that we're able to identify people who have a communicable disease, who they've been in contact with, talk to those people, and provide the guidance and support so that they can stay isolated, meaning that they have symptoms and the disease, and can stay away from other people so that they don't transmit it. And then do the same for the people they've been in close contact with to have them be in quarantine, meaning they don't have symptoms, but they have potentially been exposed, so that if they develop symptoms, they also don't transmit it to anybody else. That's the core of how we're going to be able to contain this going forward. And our health department has been contact tracing every single person who has been positive in this county. So that's over 1,200 people, sometimes as many as 100 new people a day. And that's a massive effort that that our health department has done, and that our staff have really geared up. We have a whole new fleet of people who are doing contact tracing who never did that before. And it's just been a real wonder to watch as they put that together on the fly. And then the isolation and quarantine, which comes after that, and making sure that people have the resources to be able to do that. Not everybody can as easily isolate and quarantine. Not everybody has the space. Not everybody has the resources, whether that's food or money. And so we want to make sure that we provide those things to those people who need it so that they can safely stay isolated or quarantined, and that way we can contain the spread of this. We're also continuing to go out to test in nursing homes, assisted living facilities, shelters. To date, we've tested over 400 people in those congregate settings, including residents and staff, and provided guidance and support to those facilities as well. We continue to test first responders, and we've tested over 30 to date. And we make that a core priority of ours to be able to test first responders who need that. We have Catherine Madison here today to talk about mental health issues, but I wanna just wrap up by noting, please be kind to yourself and be kind to others. These are stressful times, and we need to have the grace to both give ourselves the space to be kind to ourselves and to others as well. So I'm going to turn it back to Ellen at this point.
Thank you, Doctor. Most of the questions we've received lately have related to testing, so I have a few testing questions for you. Now that Maryland has received many more tests, does that mean more people with minor symptoms can get tested, or are there still certain limitations?
Great question. So we've all probably seen the news that Maryland got a shipment of 500,000 test kits from South Korea. Those test kits, we're working with the state health department to figure out the other pieces that need to be brought together to make it so that those tests are out on the streets, so to speak. And yes, our goal is to test it so that our goal is to make sure that we can test anybody with symptoms, no matter how minor they are.
Great. Another question, if you had COVID-19 but didn't know it and recovered, would you test positive with the current test that the health department is using?
The current test wouldn't show that. So what they're detecting is the DNA from viruses, the RNA. And so if you don't have active infection, our tests won't show that. And that's where those antibody tests, which really aren't ready for prime time yet, but are getting really close to that, would be able to help us by saying you have been infected in the past. And so we're looking over the next few weeks to see how those get rolled out and see how we can use them.
If you have had COVID-19 and recovered, could you get it again? And if so, would the symptoms be as bad?
That is a great question. And the true answer is we don't know yet. Based on what we're seeing with other coronaviruses, it looks like generally immunity lasts about 40 weeks, but we don't know how the COVID-19 is gonna operate. So the answer, unfortunately, is we'll have to see.
Thank you. This question comes from Edgewater. If someone dies in a car accident while they have coronavirus, are they considered a virus death?
That's an interesting question. I don't know the answer to that. I will tell you that the guess is probably not, unless it had a contributing factor to their death.
Okay. Then trace contacts. Are you ramping up the number of staff, as you said, that can trace contacts of positive test cases, and do you need volunteers?
So we have ramped up our contact tracing. We have over 80 people working on contact tracing, and we're looking at ways to continue these efforts going forward. In terms of volunteers, If anybody who's interested in volunteering for anything in the county, or encourage you to call 410-222-0600. At this time, we're not taking volunteers specifically for contact tracing, but there's a lot of other work that needs to be done in the county.
Thank you, Doctor. And I have a couple of more questions about reporting. Are the active confirmed cases of coronavirus coming to the health department? In what way? Are people calling in from home, or doctors calling the Department of Health? Do hospitals send in emails or faxes? How does it happen?
So we get information about COVID-19 positive cases through a variety of mechanisms. Sometimes it's the doctor's office, sometimes it's the hospital, sometimes it's the lab. But ultimately, all of this information is put into a state epidemiology database, and we use that to make sure that we get every single case, because every single person matters.
Thank you. And the last question about tests comes from Crofton. Are there home COVID-19 test kits on the market yet? And if so, what is the advantage of those, and how would results be reported?
So the one home test that just came out, I want to say 3-4 days ago, is actually a test where you're able to do the swabbing yourself and then mail it to the lab company, who would then process it and run that test kit. And so those lab companies know how to report those results to the appropriate health departments. So right now, the reporting wouldn't be an issue from that. I believe there is a cost to that test, but I don't know I'm not quite sure of the cost. I believe they said it was over $100 at this point.
Thank you very much for that information, Doctor. Now, I'm going to ask Catherine some questions about children, adolescents, and families. Catherine, the first question is, when children ask questions and show concern about the pandemic, how might adults respond?
Well, children are experiencing this whole historic event through their own childhood lens. And so we have to be very mindful of the kinds of information we give them, the way we answer their questions. I would say we should definitely limit the amount of TV exposure, TV and radio coverage, because, face it, they tend to sensationalize the negative, and kids don't really know how to process that very well. When they ask questions, quite often they don't want a factual response. What they really may need is reassurance. Some of the questions that I've heard from colleagues, from their children, are we going to have to get a shot soon before we can go outside again? And she assumed that had to do with the coming vaccine. I'm not sure. I mean, this child is a preschooler. Last week, Tracy mentioned that her 13 or 14-year-old niece wondered if there was going to be a summer. Those questions aren't really looking for a factual response. Yes, we will have a summer, but to go a little deeper and find out why they're asking that question, what their underlying concerns are. Quite often those questions come from a deeper well of uncertainty, or troubled waters under the surface. So I would just ask parents to be compassionately curious, and when their kids ask questions about the virus, to dig a little deeper and want to know where the question's coming from.
Thank you. Another parent asked, I see my children getting into bad habits or losing progress we've made, such as bedwetting. Why is that?
Well, regression is often a sign of stress or anxiety, and kids are very attuned to their adult caregivers' stress and anxiety. So if a child is feeling in need of reassurance or emotional support, they may regress in their behaviors, whether that's bedwetting or baby talk, something of that nature. I think it's very important to keep a normal routine, try and keep kids active and focused on positive activities to the extent that you can, and just really be compassionate and present for your children. No one knows your child better than you. Just try to find ways to connect and reassure your children.
As noted here, what are the signs in depression in younger kids? Are there things I should be asking or looking for? And what are possible treatments for them?
Well, signs of depression in children are very similar to those of adults. They might be withdrawn, they might be oversleeping, or have insomnia. They might be overeating or have no appetite. They may have lost an interest in their normal activities. Things that used to give them pleasure don't anymore. One of the distinguishing aspects is irritability. Oftentimes children that are depressed are more irritable, especially in middle school and teenage kids. But I think before we diagnose and look at treatment for depression, we need to find out what's underlying or driving the depression. I know kids that are out of school and no longer involved in sports or dance or, just socially disconnected. That's a real loss for them. They may be grieving. So again, if you see trends or things that cause you worry, try and find a private time to take your child aside and talk to him or her.
Catherine, this question comes from Glen Burney. I'm worried that once I go back to work, my toddler will develop separation anxiety. Is there anything I can do to prevent this?
Well, a toddler might not like it when you go back to work, but that's not the same as separation anxiety. And I think secure attachment is always a good thing. I think while you do have the time at home with your toddler, spend it well. One of the developmental tasks of toddlerhood is to separate from you. So create opportunities for your toddler to go play by himself, come back, just be a reassuring presence. You're there when he needs you or she needs you. And be there to comfort and nurture your child when comfort and nurture is needed. Just be attuned to your child in this time and develop the best bond that you can. And when it's time for you to go back to work, it'll be fine. I don't think that you should really worry about the future. Just focus on the present. Focus on having a really nice opportunity, really, to be present for your child at this important developmental stage.
Thanks, Catherine. And speaking of back to work, Dr. Nilesh, barbershops and salons. Why can barbershops and salons open before other essential businesses, and what groups can use those services, and what precautions should be taken?
It's a good question. The barbershops and salons are being opened on a very limited basis to provide grooming services to essential personnel who need those services in order to properly perform their duties. So, good example is military personnel, where there's a code of dress. Another example is are people who need to wear N95 masks and need to fit properly, and so may need to be groomed for that purpose. That's really the intent of that. When somebody is getting those services, they need to have a letter from their employer stating that it's an essential part of their job. The barbershop salon needs to keep that letter on file. They need to make sure that they are using a mask. Obviously, the person who's getting groomed, it might be difficult to have a mask on at that point, but that they're using as many of the infection control and social distancing techniques as possible, including having only one customer in the store at that time. So it's very restrictive opening, and it's really meant to address a very specific need.
Thank you, Doctor. Masks, too. We always get a lot of questions about masks, and this is one from Annapolis. I know that people are now required to wear a face mask covering their nose and mouth while out in public. Should we be wearing anything to protect our eyes, such as glasses or goggles, to prevent getting the coronavirus through our eyes?
There's no indication that the coronavirus really is spread through normal patterns through the eyes. We do recommend that healthcare workers who are doing work with patients have those face masks or shields, but that's because they're in an intense environment, very close proximity to somebody, and large amounts of aerosols are being created. So there's no need at this point that we know about for the use of either eye protection, either shields or goggles.
Thank you. And this question comes from Annapolis. I have COPD. Will the store manager have the right to judge if I am exempt from wearing a mask due to personal health conditions?
We specifically offered guidance to all of the businesses that for people who are unable to, for medical reasons, who are unable to wear a mask, that is, for medical reasons, that they don't have to do so. And that's why it's all the more important that everybody who can does so that we can protect those who can.
Thank you. Now, this question is, what about gloves? Some clerks have gloves that they use from customer to customer. What precautions should be followed when using and reusing gloves and removing them?
So gloves can be helpful. As we note, hand washing and or hand sanitizer are particularly helpful for business store clerks or staff. Wearing a glove can be a way to avoid having to do hand washing between each customer, and when they take it off, making sure that you take it off with the proper technique. And there are videos that show you that. Essentially, it means taking a corner of or the rim of the glove and peeling it outwards like that, so that you're not touching the glove surface itself, where any coronavirus can be.
Thank you. And for businesses also, what is the best way to report a business that is not in compliance with the new face mask regulations?
For any questions or concerns or compliance notices, you can call the county's line at 410-222-0600, and they'll get you to the right place to register that concern or complaint.
Thank you, Doctor. And now I'm going to slip in a few questions about rumors that we've heard lately. The first one, what about rumors that people should inject disinfectant to cure coronavirus?
So one of the things that we've talked about a lot is making sure that you get your information from reputable sources. And reputable sources include the Anne Arundel County Department of Health, the Maryland State Department of Health, the CDC. There are things that are said during press briefings that may not always be accurate. There is no evidence that the light is a way to treat COVID. Injecting bleach, sanitizer are dangerous, frankly, and people can get disfigured or die from doing that. So please do not do that. And please ensure that you're getting your information from reputable sources.
Thanks so much, Doctor. Now, Catherine, we're moving back to the kids. This question comes from Severna Park. My kids are getting bored of this new routine. Do you know any new techniques I can be trying?
Well, it sort of depends on the age of the kids, but if they're school-age kids, they're now doing Google Classrooms, I think. They're doing their virtual learning online, and that'll add a lot of structure to their day, I would imagine. But there are so many, I mean, the world has really come together to provide all sorts of online edutainment things to do. There's, you can take virtual tours of museums from Baltimore to the Louvre in Paris. You can go to the National Gallery in London. You can tour every national park in the United States with a ranger online. There are, one of my favorites is scavenger hunts, and there's a woman on Primary Playground that, I don't know how she does it, but she comes up with a new scavenger hunt every day. And it can be a dozen things that are related to colors or senses, you know, find something that stinks, find something that tastes sweet, find something that is red. You know, she has these scavenger hunts that she has posted online. I think, depending on the age of the kid, I think that it's also an opportunity to promote their involvement in the community. If you are able to do that, I think it's really nice to ask your kids to research a charity, for example, and pick a charity that's meaningful to them, whether it's an animal shelter or a homeless shelter or the food pantry. And it's really less about the amount and more about the deed, so that you're connecting kids to the larger community, and it empowers them and it helps them feel important. And it's good for their self-esteem. It helps build resilience because they feel like they can do something about a situation. They can be a force for good. So I don't know how old your children are, but there are definitely resources online, and there are opportunities in the community. So we are sort of entering, it feels like we're entering a new phase in this COVID-19 experience. So we need to find new ways. I could see why they might be getting bored. We need to find new ways to be present for each other in our community.
Thanks, Catherine. A question about testing just came in, Doctor. The question is, does the test for COVID have a high false negative?
It's a great question. So generally, we think that it's about 80% sensitive, meaning that it'll find 80% of the people who have it will test positive, which means that it's still possible that you could both have COVID and have tested negative, which is why we continue to emphasize that even when you have symptoms, regardless of the test result, that you maintain that isolation.
Thank you. And we have another question about rumors. Rumors are everywhere, and so how do we really know what to believe locally?
That's really important. We were talking about reputable sources of information, and it's also important to remember, particularly in Maryland, who is providing both accurate and timely information here in the county. It's one of the reasons we have this Facebook event. The county executive provides great information in his town halls. There's also a rotating group of people who are coming in to provide information at the state level. The governor's press conferences, very, very informative, very accurate, along with Deputy Secretary Fran Phillips. Those are really reputable sources of information, particularly in terms of local and state officials who are providing up-to-date information.
Thank you. We have this question about high risk. The cell phones. How long can the coronavirus stay on a cell phone and an iPad?
So generally, we think that the coronavirus can last on porous surfaces, so things like paper or clothing, for up to about 24 hours, and on non-porous surfaces like metal or plastic for up to 3 days. So To answer your question specifically, phones, iPads, those kind of devices can live on them for up to 3 days. So it's really important to make sure that you disinfect them, particularly phones. When you're touching many other objects and touching your phone can act as a reservoir.
Thank you. This question, the individual's saying something according to the CDC's website, and that is people who are overweight or obese are at higher risk of developing more severe illness related to the virus. Please provide more information about this, doctor.
Yeah, what we're seeing is that, and we've talked about the fact that people who have chronic diseases are more susceptible to severe illness, and that's from what we're seeing. That's true too for those people who particularly are overweight. We're seeing that they are disproportionately having more severe disease than those who are not overweight or obese.
Thank you. A question just came in from a teacher, a high school teacher. She says, many of our students and families are worried that they will be asked to return this spring or even come in over the summer. They fear that they will be asked to go back to school but have to wear masks and gloves. What would you say to them if you were a teacher?
Right now, we're still trying to understand what the course of this infection is in our county and in our state. We do know that we're going to have to, whenever children return to school, we're going to have some different procedures in place. We're going to have to make sure that we are taking those steps necessary to decrease the transmission of infection. I think right now the thing to remember is that we really haven't made a decision yet about when school is going to reopen, and certainly that's not up to us. That's up to the State Department of Education. But that decision hasn't been made yet. And as that decision is made, there's also going to be decisions made about how best to keep students and teachers safe. So at this time, I would say stay tuned and keep doing the things that we're doing. And the Anne Arundel County Public School System has done an amazing job of getting education to students and addressing equity issues, getting meals to students. And so let's keep doing that work while we're waiting to put in place the guidance for how we return to school.
Thank you, doctor. This question deals with areas that both of you are specialists in, and that is, how should split custody families work together during the pandemic? Should children stay in one house during this whole time?
Who starts?
So, okay. Well, I would say that if the kids are in a normal routine of going back and forth, that unless there are extenuating circumstances, like one of the households has somebody with underlying health conditions or is elderly, I would argue that they should maintain the routine, just on those facts. When they're out in public, they wear masks, but I think if they're going back and forth between mom and dad's house, if there aren't any other extenuating factors, they should keep the routine. I think that would be probably better for the child's sense of connection. We also don't know how long this is going to go on, so if it goes on for a few months, that's a few months without seeing a parent, perhaps. So that's not a good idea. So that's my 2 cents.
Thank you.
And the other piece of that is to, as Catherine mentioned, sometimes there are extenuating circumstances, and is to be able to negotiate between the parents to address those instances that come up. It's challenging. There's a reason that that custody is set up the way it is, and whatever system each family has is in place. But COVID has, as with so many other things, has turned this upside down too. And so maintaining those lines of communication as to what's best for the kids and for the adults involved, you may need to make some slightly different decisions depending on those specific circumstances.
Thank you. This one also deals with homes and second homes. What is the status for second home residents? Can they travel from different states, Doctor?
So generally, we are asking people not to travel because no matter what limited activity you're doing, if you're traveling, you're taking that limited activity and putting it into a new place, and vice versa. If you're going to make one move, I guess. But we don't recommend movement. And actually, there's a guidance for anybody coming from New York, New Jersey, or Connecticut that they quarantine for 14 days if they're entering Maryland. So it's a really serious issue to be traveling between areas, and we strongly recommend that you don't do that.
Okay. This question comes from Odenton. With the weather getting nicer, do you fear more people going to parks outside and possibly getting the virus or passing it along to others?
Yeah, both with the weather getting better and, frankly, as we're talking about what are the next steps to relax social distancing when the time comes, that is a concern of ours, is what happens as more people get together in spaces. And so that's where we're going to have to keep a number of these social distancing and infection control techniques in place indefinitely. They're not all going to go away. We're gonna have to continue to use masks, continue to hand wash, continue to keep those 6 feet as much as possible.
Thank you. And now I have another question about going outside in sports for Catherine. My daughter isn't doing sports now or seeing her friends, and I am concerned for her health, emotionally and physically. How do I handle this?
Well, as I was saying earlier, it's a big loss for kids when they are used to being involved in sports or being involved with, you know, the arts in some way. I mean, I would not be surprised if kids started sleeping too much or having a hard time, making constructive, positive decisions about how to use their time during the day. I mean, I think it's good that they're now doing online learning, but if I was the parent of someone in that position, I might try to connect with the parents of other kids in a similar situation and see if we might be able to come up with some kind of virtual pajama party or something that allows someone to get together with their teammates in a fun and healthy way that helps them stay socially connected while physically distancing. That's a real loss for kids when they can't be with their cohort, and they'd rather be with their friends than stuck at home with us. So if we can, as parents, find ways to maintain social connection with those people that they love to be with, then we should try that.
Thank you, Catherine. This person commented, I asked my regular doctors and they just say they're not allowed to treat me for anxiety. They do not want or say they can prescribe anything. I'm in a difficult situation. What should I do?
Well, I'm not sure again what the circumstances are. If they can't prescribe anti-anxiety medication for some medical reason, I would suggest trying some other more holistic remedies like yoga and deep breathing exercises. There are what are known as flow activities. You've probably seen adult coloring pages where there are really intricate designs, paisleys, mandalas, floral patterns, sayings. There's something about focusing in on those designs and coloring them in that is very soothing, and it gets you out of your head and into your body more. Yoga does that too. Yoga is also considered a flow activity. It improves your breathing, and it has you focusing on your body. And when you're more embodied, you're less you're less affected by the chatter in your mind. Breathing techniques are also helpful. When you exhale, you're activating your parasympathetic nervous system, and that is tied to your relaxation response. We do that sort of naturally when we're frustrated or worried, and we just, our body intuitively knows that exhaling is good for us. So any breathing exercise that has you counting with the in-breath, holding, and then having a nice long out-breath, if you count and do maybe 5 or 6 of those and then check in with yourself, see how you're feeling, that can help bring anxiety down. There are also apps out there like Insight Timer, where there are talks that help you manage stress or cope with anxiety. There are a lot of online resources out there. If you can't take medication, and really medication for anxiety for long term isn't a good idea anyway, because it's usually benzodiazepines, and those are quite addictive. So if you can manage your stress, regulate your emotions through these other physical means, that's a healthy alternative.
Thank you, Catherine. This question comes from an essential employee. I am feeling more stressed about my work duties. Is there a way I can handle this better?
Well, if you're stressed about work duties, is the stress tied specifically to the duties? And if there's a way that can be modified to bring your stress down, I think that would be something to discuss with your manager at work. If just being at work generally causes you stress, I think you might benefit from also some of the things that I already mentioned, just taking some self-care practices, practicing self-compassion and meditation and breathing exercises. When you're not at work, really try to disconnect from work and be present in your home life. Find things that bring you joy. Find things that you find relaxing, whether it's listening to music or gardening or taking walks. Whenever you're not at work, don't be at work. Don't carry it around in your head, because that'll, all of those stress hormones are bad for your body, and they have a lot of long-term wear and tear. So practice compassion and self-care. But if there are specific duties at work that are specifically causing you stress, I would try to have that conversation with your manager.
Catherine, here's another question. What do I do if I think someone is really struggling and might be considering suicide?
Well, that's a really important question. The most important thing you can do is acknowledge your concern and ask directly. I think there's a big misconception about whether you should ask somebody directly if they're considering suicide or self-harm. But it does not increase the likelihood that the person will commit suicide. Actually, the opposite is true. They are more likely to feel relieved that somebody has asked them and given them an opportunity to talk about what's going on in their head, what's going on in their life. If someone does tell you that they are considering suicide, assume that you're the only person that knows, and take that on yourself to really work with this person, come up with a plan, be that person for them. Ask questions like, do they have access to lethal means? Is there a gun in the house? Are there meds that are available that they might consider taking? and offer to hold those things for them. There are also suicide hotlines that you could give them. You know, the national line is 1-800-273-TALK. If they would feel more comfortable texting, younger people in particular feel more comfortable texting, they can just text TALK to 741-741. But these are challenging times, and these are historic times. We're in it together, and we will get through it together. And if you know somebody that is really struggling, be the one to step up and ask them the hard question. They will appreciate it, and you could save a life.
Thanks so much, Catherine. Dr. Nilesh, this question came in from Lothian. At this time, are you worried about the shortage of ventilators for patients that need them, and how will that be managed?
So we've been talking about ventilator supply with the state, with the hospitals. The way that's being managed is that the state is actually purchasing large numbers of ventilators and has a plan in place for how those can be distributed across across the hospitals in Maryland, including reallocating ventilators from one area that might not need it at that moment to another area that does need more of them at that time. So right now, I feel pretty confident that that's being managed well, both in terms of increasing the supply and better matching available ventilators in the state to where they may be needed.
Thank you. This person is asking for positive news about the county, such as how many people in our county have recovered from the virus. Is it the majority of the people who've had coronavirus?
So that's a great question. What we're seeing, there's a couple of really positive things that we're seeing. One is that the vast majority of people do recover from coronavirus. Currently, our death rate is about 4%. But that means that 96% of people recover. We do know that some number of people do have persistent problems after that. But the good news is that there's a lot of recovery, and that we seem to be flattening the curve. And we're seeing, while we certainly see new infections every day, it's not increasing as fast as we had initially feared because of all the positive steps we have taken.
Thank you, Doctor. The question that always is asked, are we in the surge, or is the surge coming up? And what about the surge?
The surge is a big unwieldy thing. So when we say the surge, we're really talking about an increase in the number of COVID cases that continues to increase until it reaches a peak, and then it starts to come down. So to say whether we're in the surge or not, we see that the number of cases, total cases, is going up every day. We see that the number of new cases is going up slightly, but is not really shooting up yet. So are we in the surge? We're certainly increasing. And the nature of these types of things is that you can only say that you were at the top after you start coming down, because you can't know that you were at the top until you start coming down. So right now, we still remain very vigilant and are putting into place all of the preparation at the hospitals, nursing homes, health department, social services, on and on, to make sure we're ready for what is a worst case scenario of many more people needing to be hospitalized.
Thank you, Doctor. Well, as time has gone by, there is one question that I would like to ask both of you that we received from a resident. And that person asked, what can I personally do to make the county's experience with COVID-19 better? Whichever.
I think we all have a responsibility as a member of the community to be as uplifting and compassionate to one another as we possibly can. I think that we need help in many different areas. Like I said, if you want to involve your family in charitable giving, if you're in a position to do that, I think that's really a nice family bonding experience, and it's very empowering for kids if they get to participate in donating or volunteering to really critical services, whether it's with the homeless shelter or the food bank or the animal shelters. That's a very positive thing to do.
Yeah, I think it's really important to just build on that to note that you can help in a couple of ways. It can be more structural in terms of volunteering or donating, and if you have that ability, certainly calling the county 410-222-0600 to offer those services, but also in your community, calling folks up, particularly those who are older or have chronic disease and really can't get out. Maybe helping, if you can and you're in a position to do so, helping to pick up groceries for them or pick up a prescription for them. I think it's those kind of acts that we see every day that really bring people closer together in a time where we're pushing people physically further apart. And it is also a really important way to help.
Thank you so much. Well, you can still submit questions, and we can answer them at covid19info@aacounty.org. And if you have symptoms of COVID-19 and would like to make an appointment for a test, please call 410-222-7256. Thanks so much for joining us today, and we will see you next week.